Veterans, the elderly, the disabled. Those are the groups that will be impacted by the looming closure of a home health benefit in Madison County. The Homemaker program has been a lifeline, allowing people to continue to live in their homes.
That lifeline is now going away, with Madison County officials blaming state-level cuts to public health funding. Our Katie Kaplan has been following this story for quite some time now. She joins us live in the studio with more on how people are reacting there in Madison County. Katie.
Yeah, Andy, Janae, more than 24 people from the most vulnerable populations will be impacted by the end of just this program. But as with a lot of things, it costs money, roughly $2,500 per client annually, according to figures presented during a BOH meeting in 2024. The county tells me when the money is not there, of course, it's hard to support. But one of the impacted families tells me they're angry and they feel left behind.
He doesn't go outside. He's now out downstairs.
It's a full-time job for Scott Sadler to keep an eye on his father, Frank.
I had a stroke and my right arm is almost numbless.
The Vietnam veteran needs a helping hand to get around his own house. Scott and his wife spend an estimated 40 hours a week managing appointments, running errands, and monitoring a batch of cameras to ensure the 83-year-old doesn't end up injured on the floor like he has so many times before.
He has fallen in the bathroom, and he has fallen in the bedroom several times.
They are grateful for the few hours of nursing aid relief the county provides each week.
She cleans the house, she does dishes, she gave me a bath.
It has taken a lot of things off my plate.
However, all that will come to an end in just a few months. Frank and the 26 other clients of the Madison County Homemaker program were notified by letter in late November.
A bunch of pressure just went back onto me. It was like, what am I going to do? How am I going to take care of him and take care of what needs to be done at our place, my family?
Health officials making the public announcement during a Board of Supervisors meeting last month.
I'm here to officially inform you all of the closure of home health services.
At the latest, the program will end in mid-June. It's something the former Board of Health chair says helped a lot of people maintain a sense of normalcy.
It's been a great program for many of my patients. It's allowed them to stay in their home. It's allowed them to remain independent in the community and that, so it's sad to see it go.
Dr. Kevin DeRene recently retired from the Board of Health after more than 30 years. He's speaking to us now as a private citizen and says the decision came down to the bottom line.
In simplest terms, it was declining revenues and increasing costs. More complex was the fact that we had lost a key staff member to retirement.
A year's worth of BOH meeting minutes shows the issue was discussed multiple times with disagreements over what to do. Ultimately, a September vote by the health board to end it passed unanimously. That decision prompting pushback from concerned citizens.
I would like to know why.
We want services that benefit all of us.
Why don't we have a public health nurse now, and why don't we have aides?
Second-term County Supervisor Diane Fitch believes that response shows residents were willing to fund it.
I think many taxpayers indicated they're willing to pay taxes to keep this.
And that there could have been an opportunity to keep the program.
Our revenues are up. We've had so much building. I think we could have found the money.
Unfortunately, Fitch says the 2025 budget has been frozen, leaving little to no hope moving forward.
This is not fair for us.
Meanwhile, more than 24 vulnerable residents like Frank Sadler and their families are left angry, feeling like those who should be most protected have been left behind.
I believe they're being abandoned by the state of Iowa. I think state of Iowa could have done better on budgeting. I think the Madison County Board of Supervisors should have done better.
And those impacted residents now have until June 13th, about 3 months from now, to figure out alternative care. The health board provided clients with a list of contact information for private in-home health services. If they can't afford that, they may have to move into a government-funded assisted living facility.
And Katie, this is one of several real hot button topics down there in Madison County that's really kind of driving a wedge into the middle of that community.
Yeah, there's a lot of questions about what's going on there in the government, a lot of turmoil and discord. Of course, we covered the arrest of the treasurer just a few weeks ago. That's an ongoing kind of issue with even more auxiliary issues being uncovered really week to week. So we're watching what's going on there, but a lot of concern from residents, of course, who are the most impacted by it all.
You could see just all those concerned residents packing into that room with the County Board of Supervisors room there.
Yeah.
All right, Katie, thanks for that report.